Hi, everyone. Welcome to Alternavita. Thank you for your time and thank you for stopping by. I'm sorry that my appearance last week was my casual clothes, but I wanted to finish the video anyway because everyone's busy in December and I'm no exception. So I didn't want to get behind any further. So I just went ahead with it. But thank you for showing up anyway, if you did. This is the final chapter um, of the science part of Immune for Life, and I'll be covering colostrum, the benefits of colostrum, and primarily this chapter is pretty much a list of clinically demonstrated benefits, and it's going to be a little hard to make a synopsis for the post, but I'll do my best. So I thought to begin with, I would just go over one of the main points I want to drive home and outline some of the most difficult obstacles you're likely to run against when explaining why colostrum is so inclusive and powerful and how it works to alleviate so many conditions. I could have easily written the entire book about colostrum alone, but I chose to include the components that work with colostrum. I chose to include the benefits of full fat mammal milk, as colostrum is basically a mammal milk product. I chose to write about some of the components that are important, like oleic acid. I only lightly covered the glycosaminoglycans, namely chondroitin sulfate. I have written about glycos gags in several posts on Alternavita as a standalone subject, but I chose just to focus on chondroitin sulfate for the most part because it's mainly the sulfate that is important in the equation of gcmaf and MAF products and colostrum itself. So, the most likely obstacles you're going to face when trying to convince people that colostrum is a adaptive biological significant substance are that their condition is especially unique, that their label isn't especially unique. This is why on my site you can see a very, very short list of some of the substances that products like gcmaf help. And maybe there's, I don't know, 150 things on that list, but I assure you that list extends to probably 5,000 or more labels. So you're just going to have a hard time convincing people that RA isn't especially different from unique from lupus as it is from multiple sclerosis, as it is from any other autoimmune condition. You're going to have a hard time explaining to people that their specific so-called infection isn't especially unique from any other type of so-called infection. And that's just a few examples, is convincing people that labels are a product of the system, and They are there to direct flows of money, mainly, and specialties. Labels and specialties are there to direct the flow of money and capital. Not that medical specialties aren't important, because the body is so complicated that I wouldn't rule out specialties, but I wouldn't assume that the liver is more or less important than the heart or whatever, or the brain or whatever. So while they do have a place, just remember that they were initially set up to direct capital. So that's one area where you would likely have a problem convincing someone that their condition isn't especially unique. And in this regard, there are only a few two true outliers, and from that began before the tsunami of not breastfeeding, and that would be diabetes and cancer. However, a healthy gut certainly alleviates and or prevents both of those conditions as well. So that would be the first instance where you are going to have a hard time convincing a friend or a loved one or anyone in particular that their condition isn't especially unique. And secondly, you're going to have a hard time convincing people that there are three main risk factors for all 95% of chronic conditions, and those are, in hierarchical order, not breastfeeding, which leads to the condition known as SAM, severe acute malnutrition, and that many of these conditions are malnutrition syndromes that develop into a progressively worse state with aging. So, and I might be doing a reaction video about that next week. But, so yeah, 95%, over 90%, up to 95% of chronic conditions can be caused by three main risk factors, and in hierarchical order, those are not breastfeeding, leading to immature microbiota development, leading to severe acute malnutrition syndromes. Number two is food security, and that would be quality food and or lack of food. And number three is poor sanitation. Poor sanitation prior to the era of not breastfeeding in mass was probably number one. And that became alleviated when we began to understand the importance of food and water sanitation. So those are the two main obstacles that you'll have when discussing this subject of the importance of a healthy gut, the importance of breastfeeding, and colostrum being a major component of helping to build the microbiota, as well as helping to build the immune system. Hello, me again. Before I forget, and I should have written this down because this is a very important point. In the beginning of the video, I said that some of the most difficult things you're likely to encounter when helping to convince people about multi-label syndrome and their condition not being especially unique, or is not as unique as they are led to believe it is. One of the ways they are overcoming this is to show the importance of the microbiota is that they are tackling the pillars of disease instead of going condition by condition, where we have to do clinical trials on every single condition before we can prove that um, the microbiota is related to all. What they are doing is they are healing the microbiota and then showing how it is affecting these pillars conditions. And these would be autoimmune, arthritis, mental conditions like autism, infectious diseases, and obesity. So, metabolic syndromes. So, that's a very brilliant approach that you might want to use when trying to convince someone that when these studies where they transplanted fecal transplants, where they transplanted from a healthy donor to a sick donor and reversed the condition, and vice versa. I believe one of the first ones was obesity, and they went on to do this in other conditions, what I called the 5 pillars, and they got this similar results. So that's a brilliant strategy attacking these pillars. And another brilliant strategy I've often mentioned was that approach by Dr. Robert Lustig and colleagues. I can't remember who exactly, but when it comes to diet, his approach was to only keep the junk, but only eliminate the sugar. And that alone affected the outcome. So when it comes down to variables and things like that, these are 2 brilliant approaches. One is attacking these pillars of conditions and showing how the microbiota alone is affecting them. And that also included autism, I believe, where they gave fecal transplant from a healthy donor, and the child was neurotypical 2 years after the transplant. And one of those first studies that amazed everyone was regarding obesity. And then they went on to do it in those 5 pillars that I just mentioned: obesity, mental conditions, autoimmune, arthritis, and infectious. So that's something you'll want to keep in mind. Is another long list that you're going to have to, all these are straw men that get thrown up there. People think their condition is especially unique. People don't understand that they have narrowed this down to 3 risk factors in hierarchical value in people, and they have alleviated and or reversed and or caused these conditions just by using just by creating a healthy and or unhealthy microbiota. So, and then the final one is the inclusion of sugar, namely fructose, as opposed to sucrose or glucose, in demonstrating that it's not even what you might be assuming in diet, as in carbs. So, okay, those are just brilliant approaches, and I didn't want to let you forget that might be another avenue you might want to use when hoping to encourage someone to try oral natural immune therapy. Okay, thanks again, everyone. I'll see you next time. Bye. So let's move on to colostrum and the clinically demonstrated benefits of colostrum. I'm just going to be going through a PDF here. So one of the most important parts is that colostrum is a living system. Colostrum contains living white blood cells, leukocytes. Bovine colostrum contains viable cells such as neutrophils and macrophages that secrete special proteins to support the immune system, including cytokines, lactoferrin, and proline-rich peptides. So, colostrum being the least processed of milk products is a very healthy product due to that fact. Very minimal processing because animals rely on it, and therefore farmers rely on it, especially if a calf is not feeding and or the mother isn't nursing. So this is why colostrum is the least processed mammal milk product. So I want you to keep in mind that you could kind of consider it like a blood transfusion. So just let me get to the page I need to get to here, the chapter. And I'm going to just go over this. And if something in this list pops out at me, I'm going to read it to you. And I'm going to start with number 4 because we covered the major categories, that the components of colostrum can be classified into 3 major categories: nutritional, immune, and growth factors. And this is helping to establish the immune system and develop the mature gastrointestinal tract of the infant mammal. So proline-rich peptides regulate the thymus gland. This is number 4. And in this list, I have at least, I think it's 78 clinically demonstrated benefits. Immunoglobulins A, D, E, G, and M. IgG neutralizes toxins and microbes in the lymph and circulatory system. IgM destroys bacteria. IgE and IgD are highly antiviral. Number 6, lactoferrin, an antiviral, is also anti-inflammatory and antibacterial. It's an iron-binding protein with therapeutic effects in cancer, HIV, other viruses, including chronic fatigue syndrome, candida, and other infections. Cytokines regulate the duration and intensity of the immune response and are responsible for cell-to-cell communication. They boost T cell activity and the production of immunoglobulins. Lysozyme. This aids in hydrolysis and boosts the immune system and is capable of destroying bacteria and viruses on contact. Some of the important enzymes are lactoperoxidase, thiocyanate, xanthine oxidase, and peroxidase, which oxidize bacteria through their ability to release hydrogen peroxide. Leukocytes stimulate interferon production. Trypsin protease inhibitors prevent the destruction of immune and growth factors in colostrum. Lymphokines mediate immune responses. Oleopolysaccharides and glycoconjugates attract and bind to pathogens, preventing them from attaching to or entering the mucous membranes. Orotic acid prevents hemolytic anemia. Some of the growth factors are EGF. These help in enhancing cell and tissue growth, and they also help by stimulating DNA formation. Proline-rich peptides present in colostrum function as regulatory substances of the thymus gland, lymphocyte and T cell overproduction, allergy, and autoimmune symptoms such as pain and swelling are inhibited by proline-rich peptides. They have been reported to improve or eliminate symptoms of autoimmune diseases like RA, MS, lupus, and allergies. We're up to 17. Colostrum may have a beneficial function in the prevention of cardiovascular diseases. I'm not going to read these entire paragraphs here, otherwise we'll be here all day, but colostrum is helpful in reversing infection-induced inflammation in the digestive tract and improves mucosal integrity, tissue repair, and direct antimicrobial actions. Colostrum has antiviral, antifungal, and antibacterial properties. I'm going up to 21. Colostrum is capable of killing Candida and H. pylori and 5 types of streptococci and cryptosporidium. It's been demonstrated that colostrum increased natural killer cells, improve the immune response to the flu, and induced toll-like receptor responses. Colostrum is 3 times more effective than vaccines. Colostrum-fed cows produce higher titers of antibodies than hyperimmunized cows. And this is also important if you think mAb drugs are immune therapy. mAb drugs, when they tested mAb drugs on cows, with each successive mAb drug they introduced, they lost more and more cows. So hyperimmunizing cows with vaccines and or mAb drugs is a dangerous proposition. Colostrum alleviates symptoms of influenza and prevented death and weight loss in animals given a lethal dose of flu viruses. How they did that, I don't know. I'm not going there at this time, but that's probably a BS study. Because, first of all, they wouldn't know if it was in there or not because they wouldn't. That's never been done. Colostrum contains leptin that induces satiety and a feeling of fullness. Required for metabolism of fat and energy production occurring through the Krebs cycle. Topical application of colostrum significantly promotes open wound healing, skin growth, and also helps in the repair of RNA and DNA. Colostrum aids in the growth of nerve cells, skin, cartilage, muscle, and bone. Colostrum reduces NSAID gastric injury. Colostrum helps prevent diabetes type 1. Colostrum helps B cell regeneration, leading to insulin release. And, oh boy, okay, this is regarding linoleic acid and lactoferrin. Patients with IBD showed marked improvement after taking colostrum. Colostrum is extremely protective in the digestive system because of its glycoproteins and protein constituents. Colostrum stimulates lymphoid tissue, providing benefits in aged or immune deficient people. Colostrum stimulates maturation of B lymphocytes, types of white blood cells, and primes them for the production of antibodies, enhances the growth and differentiation of white blood cells. Similar activity in both cow and human colostrum can also activate macrophages. Bovine colostrum contains high level of growth factors that promote normal cell growth and DNA synthesis. And I want to emphasize normal cell growth because when people hear about growth hormones, they automatically think of cancer causing growth hormones, and that is not the case with colostrum. Let's see, rheumatoid arthritis. Rheumatoid arthritis and osteoarthritis patients showed significant improvement after supplementation with some of the peptides in colostrum. Colostrum creates stem cells, and especially in the bone marrow. Colostrum colostrum activates bone marrow stem cell activities. Colostrum has unique adaptive strategies because it stimulates it either modulates or it modulates overactive systems and bolsters weak immune systems. So it's adaptive. Proline-rich peptides in colostrum act both in vivo and in vitro. PRP was shown to recruit suppressor T cells in a model of a T cell independent immune response in suppressed autoimmune hemolytic anemia. The world scientific community is unanimous in the opinion that lactoferrin in breast milk and colostrum can break the vicious cycle of antibiotic-related problems. It's possible to transfer cell-mediated immunity to recipients by leukocyte derivatives, gave a new opportunity to medicine, such as cancer, autoimmune diseases, immunodeficiencies, and allergies. And that was 2016. Colostrum contains polyclonal antibodies against endotoxins. And this is going on about lactoferrin, the benefits of lactoferrin. Clinical trials with bovine colostrum provide evidence that oral application reduces the influx of endotoxins from the gut, and this appears to be a major mechanism underlying its therapeutic effect in patients at risk for septic shock. Colostrum not only reduced LPS levels in the peripheral blood, but also inflammatory parameters and C-reactive proteins were also found to be diminished. Okay. Just trying to. This is still about lactoferrin. And by the way, these components don't seem to work as well when they are used alone as they do within the whole substance. PRPs may be used for supplementation of modified milk and infant milk formula to make it closer to breast milk. It has been well documented that mammalian colostrum is a rich source of health-enhancing components, including the immune system supporting factors. Colostrum, the pre-milk fluid produced by mammals during the first 72 hours, contains a high concentration of various constituents and specific immune cells, such as lymphocytes, T cells, lymphocytes, B cells, neutrophils, and macrophages. Okay. Okay. Colostrum is beneficial for cachexia, chronic disorders suffered in those who have undergone chemotherapy, and excessive loss of body weight. Okay, these are some of the brain substances that colostrum helps. BT, brain-derived neurotrophic factors. And you can read about that if you purchase the book. But these are just some of the components in colostrum. So I'm just going to read these last few paragraphs, which are derived from suppliers and manufacturers who are seeking to utilize colostrum as medicines. Immunoglobulins again, IgG, IgA, IgM, IgD, IgE1. These immunoglobulins naturally target a range of human pathogens, including rotavirus, Shigella, E. coli, Salmonella, and other pathogens and multicellular parasites. Cytokines, IL-1, IL-6, TNFA, interferon Y, and ILF1RA2. Also contains lactoferrins, lysozymes, lactoperoxidase, and proline-rich peptides, growth and repair factors, IGF-1 and IGF-2, epidermal growth factors, EGF, transforming growth factors, TGFA, and TGFB, oleosaccharides, and glycoconjugates. Oleosaccharides are prebiotics as they are neither digested nor absorbed in the upper intestinal tract, but are delivered intact into the colon where they can act as nutrients for colonic microflora. Specific oleosaccharides support the growth of beneficial bacteria and modulate the microbiome. Again, colostrum can help increase commensal bacteria 52-fold. Oleosaccharides and glycoconjugates in milk and colostrum are soluble receptor analogs of epithelial cell surface carbohydrates and can therefore compete with virulent bacteria for attachment sites. Sialylated oleosaccharides have been shown to inhibit binding of pathogens like E. coli. So these are from the developers of some colostrum supplements and or colostrum as medicine. So, okay, I could have easily written the entire book about colostrum, but I chose to follow the pioneers in this therapy and also include the specific components in gcmaf, MAF, colostrum, and other products like Bravo yogurt, and include some of the important components such as whole fat mammal milk, oleic acid, some of the glycosaminoglycans, and of course the ever important probiotics, especially those important for infant gut development such as bifido and other probiotics. So the entire book is not only about colostrum, but mammal milk and oleic acid in particular. Some of the other important oils like the omega-3s, and how all of these components can work together, even though they are still in the rudimentary discoveries of all of these molecules. But however, at the same time, the importance of some of them, specifically lactose, goes back at least 500 years of things they have known about these particular components that I wrote about in Immune for Life. So, okay, everyone, this is the last chapter. I don't know what will be coming next, but I'm thinking about doing a few reaction videos. We'll see. I haven't planned that far ahead, but I hope you'll find this book helpful in treating whatever condition you may have, and in treating, I don't want to say treating, I'm not allowed to say that, but you know what I mean. So I hope you'll find the book helpful for whatever your condition may be, whatever your age may be. Again, it's beneficial for children, teenagers, young adults, and seniors, in particular, infants and seniors. So, okay, have a good one, everyone. I'll thank you for your time. I'll see you next time. Bye.